Hello everyone, I am Dr. Kevin Kuo. I'm a part-time dentist right now, along with being a full-time endodontics resident. I am in training to become a specialist in root canal therapy. I would say my first inclination of dentistry began in high school. I had classmates whose parents were dentists, and I did admire them afar. I admired for a lot of the typical popular reasons to become a dentist. And a lot of those are the great work and life balance. You're able to work during the day and make a real impact on patient by seeing many people, but at the same time get to go home and have a life outside of work. The other things that I really looked up to my friends' parents who were dentists were their ability to satisfy different parts of mental challenges, which is science. You have to be a doctor in health. You also have to be artistic too, and being able to do both and help people is an amazing ordeal. Another reason is you're physically working on people. It's one of the best feelings to be able to physically do something and see immediate results and to help someone with their oral health issues. But I would say in undergrad, when I was in college, that was when I was 100% sold, but for different reasons. For me, what really sold me about dentistry was for its immediate impact. So if you look at medicine, there's a lot of science going on, there's a lot of research, a lot of new technical improvements, but a lot of those are a little bit further away just because the body is a little bit more complicated, there's more things involved, and there's more immediate life or death sort of situations. Now with dentistry, not to say it's less important, the impact could arguably just be as important. We all have to eat, we all have to have an aesthetic smile. But with a lot of the leapfrog research and techniques could be done in my career path. The regenerative processes, the new materials that are able to sustain everyday function better or have aesthetics that look like more natural teeth, those can be done right now or in the very near future. So right now I'm kind of your atypical person, professional in dentistry. I'm a full-time resident, so a lot of it is training, studying, but at the same time I do see patients in private practice. So I'm in that rare combo right now, but it's a great time to kind of think and gauge why one would like to do in the future. So as far as my weekly schedule right now, I'm typically in residency from 8 to 5. It's a combination of seeing patients, studying, lectures, whether receiving or giving, doing research. That's encompassing most of my time during the day. Now in private practice, I am solely focused on procedures that I am doing training on, the simpler ones of course, with root canal therapy. Most of my time in private practice are on the weekends where there's more time, but occasionally I do work in the evenings here in Boston. Boston is a very competitive healthcare sector in the United States, and so a lot of practice still open actually really late at night. Besides residency and besides private practice, I do enjoy doing just this, making videos about dentistry. I feel like I can talk about it every day, every night, and being able to share it to others is another passion of mine. It's something that's really fulfilling for the past couple of years. Now, I don't want to make dentistry sound like this perfect field. There's obviously a lot of great things, and that's why I'm excited, but there's still a lot of things that need improvement. Some of the problems that we face in the field start from the individual level of a tooth, where our materials can still be a lot better. We have great materials now, but there's still deficiencies in strength and lifetime in preventing bacteria and getting in. And so there's work on an individual level for sure on just a single tooth and restoring it. But on a greater scheme in looking at the population, we're also having trouble getting access to dental care for a lot of the population in the United States. And that's a great thing about you guys, future young professionals, is that we still need your help. And it's beyond just seeing patients. That's obviously important and the primary goal. But with these days and age, like bringing the fresh ideas in the next generation will be tremendous for our profession. And ultimately, it would really help our patients in the long run. There's a lot of problems to be solved from the small level to the big level.